For centuries, a deadly disease called smallpox separated among people, spread, causing boils filled with yellow pus to appear all over the bodies. Some people also went blind and many died. Those who survived the disease were usually left with deep scars. In England, in the 18th century, there was a huge outbreak of the horrible disease. But a cattle breeder named Benjamin observed that mild disease affects the cow called cowpox looked very similar to the deadly and contagious smallpox. He noticed that cowpox could also affect humans, but in a lesser way than smallpox. The interesting thing was that he himself, the milkmaids who had previously had been infected with cowpox, never got the horrible smallpox. Somehow, a cowpox infection protected them. This observation inspired Justify to try and protect his family in the same way. He infected them all with the cowpox, and it worked. None of them ever developed smallpox. A few years later, a doctor named Edward Jenner built a discovery. He wanted to prove the theory that getting cowpox could protect a person from smallpox. So he took a bit of pus from a cowpox blister on the infection made and put it into a cut in arm of a young boy. When Jenna exposed the boy a few days later to the smallpox virus, he did not develop the disease. Just like Jenny and the milkmaids, his body had learned how to fight the disease. We say he became immune to the disease. This way, a crucial step in the development of vaccine. In fact, the word vaccine thought by Jenna comes from the Latin word of cow vaker. Following Jenna's experiment, smallpox vaccines began to be procured in large quantities. Millions of people got vaccinated in every corner of the world. Until in 1980, the World Health Organization announced that smallpox had been eradicated. Today, we no longer need to use the smallpox vaccine, as the virus is no longer circulating. The story serves an example of how vaccines can help in the fight against infectious disease. Thanks to Jenna's discovery, we got rid of smallpox and are now continuing our work to educate